So thank you for having me today then. My name is Jonathan Richardson. I'm one of the Senior Medical Information Scientists with the UK Teratology Information Service. We're one of the member organisations of the ENTIS network, and I'm going to speak to you about how we operate as a network and what we are and how we do things. So what is ENTIS, first of all? So we're the European Network of Teratology Information Services. We were founded in Milan in May 1990 when there was a small group of interested clinical academics that were providing information to healthcare professionals or pregnant women or their partners about how environmental exposures which arise during pregnancy might impact the developing fetus. And the network was founded with the aim to coordinate and collaborate these members, these original members here in the top part of the screen, to in how they were providing their information, how they were collecting information, evaluating that information and communicating the data, all with the primary aim of preventing birth defects and developmental disorders which were arising or which could arise as a result of inadvertent environmental intoxicant exposures. So since the network was founded in May 1990, it's grown quite considerably now, and there's now 41 affiliated organisations in 27 different countries that are spread across five different continents. We exist as a not-for-profit organisation which is independent, which operates independently from the pharmaceutical industry. And there is no central funding for the European network. It is completely undertaken on a voluntary basis by the members of staff which work at the individual teratology services which make up its membership. Additionally, as well, we have some quite close affiliations with the Organisation of Teratology Information Services, which is ENTIS in North America, and they're in red on the map here below. So what are these member teratology information services that make up the network of ENTIS? Well, again, they're not-for-profit organisations which are generally publicly funded, and they operate their services either regionally or nationally. And they provide their services free at the point of care to their enquirers, and all TISs operate this first information provision service. So they'll all provide information about how exposures which arise during pregnancy might impact the developing fetus. And some, but not all, we would probably say most, have involvement with exposure safety monitoring, depending on the information which is communicated. And we'll talk about these two now. So the environmental exposures to which we refer to that a teratology information service can be contacted about are generally biological, chemical or radiological. But as we see, if we look at the data, generally the vast majority of our enquiries that we receive as clinical services is actually about medicines use in pregnancy and whether or not that is safe. Looking at our own data, it accounts for more than 9 out of every 10 inquiries that we receive. And teratology information services all are slightly different but operate very similarly, and so they can have different audiences. Teratology Information Service in the UK, for example, only speaks to healthcare professionals, whereas there are other teratology information services that only speak to pregnant women or their partners, so medicines users, and then other services which speak to a combination of the two. And when they provide their information, they provide it through a number of different ways as well. Some will operate telephone inquiry lines where they can discuss safety of exposures which have occurred or are planned to occur during pregnancy. Some TISs will provide written information which is available openly on websites, or will be emailed to enquirers when requested. And other teratology services also provide information through face-to-face clinical sessions. And the information that they provide is always a risk safety analysis or a risk benefit analysis of whether the safety of a medicine, of using a medicine, the benefits of using a medicine potentially outweigh any known or predicted or hypothesized risks which may exist. And the information that is often requested of teratology information services generally focuses around 3 main areas. We generally get the prospective enquiries from either healthcare professionals or the medicines users themselves. They would be asking questions along the lines of, I have a patient that is requiring a medicine, she is planning a pregnancy. Is this safe to do so? Or it may be that the health professional is contacting us saying that they have a patient that is currently pregnant, inadvertently become pregnant whilst using a medicine. What are the risks? What are the benefits of continuing it? And alternatively, we can get the retrospective inquiries where an infant has been born with a congenital anomaly, or a pregnant woman has experienced an adverse pregnancy outcome, and they're wanting to inquire as to whether the exposures, the medicines that they used during pregnancy, whether they might be linked with those outcomes based on what is known in the published literature. Now, using this information resource, which Teratology Information Services provide, allows some, like I said, but not all, to perform safety monitoring. And the safety monitoring procedures of different TISs will vary, but most will follow this simple structure, which we're going to demonstrate here on this slide. So primarily, the first step of the TIS safety monitoring comes at the information provision stage. So when an inquirer contacts a service wanting to discuss whether a medicine is safe in pregnancy or not, a large amount of clinical detail is taken about that individual. So her background, her medical background, her obstetric history, the exposure scenarios which has occurred, and any pregnancy complications which have existed to date. Once the risks and benefits have been weighed up about the medicine and the information has been communicated as to whether it's safe to use that medicine or not, then that follow-up of the pregnancy can potentially be entered into, or that pregnancy can be entered into the follow-up system. And the follow-up system will kick into action once the estimated due date has elapsed of the pregnancy, and different TISs will attempt to follow up pregnancies in different manners. So some will operate a telephone interview with the original enquirer who contacted the service. Others will perform a postal questionnaire or an email questionnaire, and potentially others as well might have access to electronic healthcare records which they can query to try and identify the pregnancy outcome. And again, at the pregnancy outcome data collection, we request and collect a large amount of information. So that would relate to what was the remainder of the pregnancy course, how did that appear? What was the pregnancy outcome? Was it a live birth, a miscarriage, a termination of pregnancy? How was the health of the infant at delivery? Was there any evidence of congenital anomaly, preterm delivery, low birth weight, etc.? And once that information has been collected, the information is then quality control checked, which is a very important step. And again, different TISs will use different methods. Some will just perform basic analyses or basic interpretation of the data to make sure that medically it makes sense for what was reported in the first instance. Others might involve a more stringent quality control measures where if there's been an adverse pregnancy outcome reported, they would double check that with an additional data resource. Once these quality control measures have been applied, then the data will be stored in a secure database against which data analyses can be run. And the stimulus for data analyses will probably vary, again, across different TISs. Some will potentially operate periodic and structured analysis of the database to try and see if there are any known or emerging associations between adverse pregnancy outcomes or patterns of adverse outcomes linked with certain medicines. Other TISs might investigate the database on a more ad hoc basis, that being if there's been any indication of a signal in the published literature, does their data set support or refute those claims? Or, and perhaps most importantly, if a TIS is receiving a large number of inquiries about whether a medicine is safe to use in pregnancy or not, that might stimulate them to go and investigate their own data and provide some published data if published data are unavailable. So once these data have been analysed, they'll be potentially communicated in a variety of different ways depending on the TIS. Some will report to local regulatory agencies, others might just report in the published literature. But importantly, Teratology Information Services trying to identify whether or not there is a link between adverse pregnancy outcomes and medication exposures is a very difficult task. particularly if we're looking at rare adverse outcomes potentially being linked with rare exposures which arise during pregnancy. And it was understood from, and this is taken from the meeting notes of that very first meeting of the Teratology Information Service network, it was understood from the very beginning that actually there is vast benefit in pooling data that's available at each individual TIS in a collaborative ENTIS model, which is allowed to be done because we are collecting data in a very similar way, collecting very similar data variables, and that we can put together and have more accuracy about whether or not associations may exist between adverse pregnancy outcomes and certain exposures, medication exposures in pregnancy. Again, the same issues arise with regards to what stimulates these collaborative ENTIS studies. Generally, they are more ad hoc than routine. We don't undertake routine screening of the ENTIS data. It doesn't exist in one single location. So until it does, we're unable to do that. But what we can do, if signals have been produced in the literature, or if there's a public health emergency about which there is no evidence about safety, so for example, COVID vaccines, then it might be suitable to combine data in a collaborative model. Any collaborative study which is proposed is usually brought forward by an individual TIS and suggested to the ENTIS scientific committee, who review the study protocol and accept it for a collaborative method. And then it's performed by the service which has initially suggested they want to do the research. So there are some benefits to collaborative ENTIS monitoring, primarily focusing on that initial discussion on the counselling of risks and safety and benefits of medicines use in pregnancy. There's a large amount of clinical data that's collected at that discussion. And as a result, we have a very rich data set, which is specifically designed for pregnancy safety monitoring pharmacovigilance purposes. Also, we have this large international coverage now, which allows us to collect in a collaborative way a large number of exposures, potentially quite quickly, depending on where in the world these administrative data sets are based, for example, that might have time lags or time delays between the time at which exposures occurred and when the data enters into the systems. It may even be feasible for ENTIS methods and TIS methods to be quick in collecting the data together. And perhaps most importantly, the ENTIS expertise which exists within the network. These are the experts that work at these different services investigate this pregnancy exposure safety data on a daily basis, and therefore highly experienced in looking for pitfalls and limitations which exist with various different study methodologies. And that's very important when thinking about communicating the methods and communicating the results of any collaborative studies which have been undertaken. So that's the way in which we work. If you're a healthcare professional or a medicines user and you want to speak with someone about whether or not it is safe to use a medicine during pregnancy, then we would encourage you to go to the ENTIS website, which is here, and look for your local TIS, find the details for your local TIS and contact them if you can. Alternatively, if you're interested in reporting pregnancy exposures which have arisen during your pregnancy, depending on where in the world you live, there may be a local TIS which accepts online information reports. And this is true of the Netherlands and the UK, which have these two different websites here. So that's the ENTIS network as a brief overview.